my name is Ashley. I'm the student nurse practitioner that's going to be taking care of you today. Do you mind if I go over some questions about your health history and personal history to begin with?
Sure.
Okay, what are you in for today?
I'm out for here for my yearly physical.
Okay. And do you have any concerns or questions or about illnesses or symptoms that you've been having recently?
No.
Okay. Do you have any taking a medication on a daily basis?
On a daily basis, I do take the lisinopril for my high blood pressure.
Okay, is it lisinopril by itself or is it mixed with something?
Probably mixed with something.
What's the brand name of the drug?
I know it's the lisinopril, but I know it's in this 20 to 25 dosage wise, but I'm not real sure.
Does it have a different name?
No. The Hyzar.
Hyzar? Okay, so it's mixed with the...
Yes.
And you said 20 and 25 are the dosages?
Right.
How often do you take that?
Take that every night.
Every night? And you're pretty good about taking it?
Yes.
How long have you been diagnosed with hypertension?
Started taking it when I was about 23.
Okay. Alrighty. Any concerns with your hypertension today?
No.
Okay. Alrighty. Do you have any allergies to medications?
No.
What about environmental or food allergies?
No.
No allergies? Okay. Alrighty. Let's go over some childhood illnesses. When you were younger, did you ever have the chicken pox?
I'm unsure.
You're unsure? Okay. What about measles or mumps?
No, I'm unsure too.
You're unsure about that too? Okay. What about vaccines? Were you fully vaccinated as a child?
Yes.
Yes. Do you get a yearly flu vaccine?
I do.
Okay. And when was the last time you had one?
Probably last year.
Last year? Last flu season?
Yeah.
Okay. What about a tetanus booster? Have you had one of those in the last 10 years?
I have.
Do you remember when?
Probably about 5 years ago.
And why did you have to get that?
I was at work and I did something. Did something with my finger, and when I had it happen, I had to go to the ER and get it fixed up, and then I had to get a tetanus to make sure everything was fine for it.
Okay. What about a TB skin test? Have they ever done a skin test? Have they ever done a TB blood test on you?
No.
No? Okay. Alrighty. What about any hospitalizations as an adult?
As an adult, I had a brain tumor when I was 13.
But no hospitalizations as an adult?
No.
So no pneumonias,
No.
no sicknesses, car accidents, traumas,
No.
nothing like that? Okay. And any surgeries?
I guess the brain tumor was because when I was 13.
Okay.
And I also had a broken jaw when I was probably about 15 playing baseball.
Okay. Tell me about your brain tumor.
Brain tumor, it wasn't cancerous.
Okay.
They just went ahead and opened it up, took it out. I did have after the year after that, I had my regular routine of make sure everything was fine.
Okay.
But then after that, what happened after that?
And you said you were 13?
Yes.
Okay. And do you remember the doctor who did it or where you had it done?
It was Dr. Stringer in Jackson, Mississippi.
Okay. Alrighty. So let's talk about the broken jaw that you talked about. How old were you?
Probably about 15 when that happened.
Okay.
I was out playing baseball, and I had this side of my jaw over here broken, the other side over here fractured.
Okay.
And so I had to be wired shut for at least 6 weeks.
Okay. So surgery for that. Do you remember the doctor who did that?
I don't remember the doctor did that.
Okay. And do you remember where it was?
That was in
hospital?
Jackson also.
Okay. Alrighty. The next list of illnesses are going to be about you. These questions are going to be about you. Okay. So we've already talked about your hypertension.
Right.
That you've had since you were 23. What about any history of cancer in your history?
No.
Okay. How about liver or kidney disorders?
No.
Stroke or heart attacks?
No.
Any asthma?
No.
History of blood transfusions?
No.
Okay. Any other conditions that you've been diagnosed with?
Condition was just I have the HCN1 genetic disorder.
And so that's a gene mutation?
That's gene mutation, yes.
Okay. And how did you find out that you had that?
Actually, when I had my son, we were at Baylor here in Austin, and we got it tested for it then. There were some complications with him, and so me and my wife we all both got tested for it, and I was the one that carried the gene mutation.
Okay. And so what was he showing symptoms of that required this testing?
Seizing, throwing up,
Seizures and vomiting?
Seizures and vomiting, that type of thing.
And have you ever had those symptoms?
No, I've never had those things.
Okay. Alrighty. Any diabetes, type 1 or type 2?
No.
Okay. So we're going to go over your family history now.
Okay.
We're going to start with your dad.
Okay.
Is your dad living?
Yes.
How old is he?
He's about 70.
Okay. And does he have any medical conditions that you're aware of?
He's got the blood pressure also.
Okay. Alrighty. And what about your dad's father?
My dad's father, he was adopted.
Your dad was adopted?
Yes,
Okay.
He was adopted. My dad's real father, we don't really know much about. I think he had some type of alcoholism in his system or whatever. We really don't really know. We're not sure about that though, honestly.
Okay.
But my dad's stepfather is living,
Okay.
and so he's probably in his 80s by now.
And the stepfather is the one who adopted him?
He's a stepfather, yes, he's the one that adopted him.
Okay. So you don't really know much about your
No.
biological grandmother?
No, I don't.
Okay. What about your dad's mother?
She's not living anymore either.
Okay. Do you know how old she was when she died?
I'm guessing maybe 80.
Okay.
I'm not really for sure though.
Do you know of any medical conditions?
She also had the high blood pressure, but I'm
High
not
blood
really sure
pressure.
about anything else.
And was she your dad's biological
Yes,
mother, or
she
did she
was-
adopt him as well?
No, she was his biological
Okay. Alright.
mother,
Okay.
yeah.
Alright. What about your mom?
My
Is she
mom is
living?
living, yes.
Do you know how old she is?
She's probably in her 60s, probably upper 60s probably by now.
Okay. And does she have any health problems?
She's got the cancer.
She's got cancer. Do you
Yes.
know what kind or what stage?
I don't know what kind or what stage.
Okay. How long has she had cancer?
Probably here a few years.
2 years. Okay. Alright. Seems to be doing okay with
Seems
it?
to be controlling it very well though, from
Okay.
what the doctors told her. So
Okay. And what about her dad? Her father?
her dad is dead now too.
Okay.
He's
Do you
been
know
dead
how
for-
old he was when he
I'm not sure about that.
died? Okay. Do you know of any medical conditions that he had?
I don't know. I think he was kind of an alcoholic. I don't know if that had anything
Okay.
to do with it, a lot, but
Okay.
that's what I've been told.
Alrighty. And what about her mother?
Her mother's not living either.
Okay.
I don't really know how old she actually was.
Okay.
I just know that she's, of course, been dead for a while now, so
Okay. And do you know of any medical problems that she had?
not that I know
Okay. Do you have any brothers or sisters?
of. I've got one of each.
Okay, let's start with your brother. How old is he?
He
And
is
is he living?
28 and he's living.
Okay. And married, have children?
He's married and got 3 kids now.
Is there any health conditions with him or his children?
Not that I'm aware of.
Okay. And then is there, with your sister, is she living?
She's living.
How old is she?
She's probably 32.
Okay. And does she have any health problems?
Not that I'm aware of.
Is she married and have children?
She's married and got 2 kids.
Do her children have any health problems?
Not that I'm aware of.
Okay. Now, you said that the HCN1 gene mutation that your son had, they found it in you. Is there
Right.
anybody else in your family who has that?
Not that I'm aware of.
Were they ever tested?
No.
Okay. Alrighty. So is there any other family history of any diabetes, type 1 or type 2?
Not that I know of.
Any other history of hypertension besides you, your dad, or your grandmother?
No.
How about cancer besides your mom?
That's it as far as I know.
Okay. Any heart attack or stroke in your family?
No.
What about liver or kidney disease in your family?
No.
Okay. What about any history of asthma in your family?
No.
Or any other conditions, chronic conditions in your
Not that I
family?
know of.
Okay. Are you married?
Yes.
How long have you been married?
Almost 12 years.
And what does your wife do?
What does my wife do?
Yeah.
She works at Seton Hospital.
She works at the hospital?
Yes.
Okay. And what do you do for a living?
I work at 84 Lumber in the warehouse.
Okay. Do you like your job?
Yeah.
Yeah. Do you ever call in?
I can't afford
Sick?
to.
I understand that. Do you have, and you talked about your son. Do you have any other children?
He was the twin of the daughter we could have had, we should have had, and that she didn't make it.
Okay, was
So
she
it was-
miscarried or was,
She was a miscarriage.
did she die after birth?
She was miscarried.
Okay, do you happen to know how far along your wife was at that
I
point?
forget, to be honest with you.
Okay, and any other pregnancies?
We had one more before that one, and that was also a miscarriage.
Okay. Do you know far along she was that
No.
time? Do you know if that one was a son or a daughter?
That was the first one, the twins would have been, the son's now living now, the other one would have been daughter, they've been twins for there. And I think the other one would have been son.
Okay. So y'all were able to know the sex, but you
Right.
don't know how long it was?
Yeah.
Okay. Same, is this with the woman that you're married to now?
Yes.
Okay. Alrighty, do you know what caused the miscarriages?
No.
No? Okay. How about, do you live in a house or an apartment?
House.
And do you own or rent?
We rent.
Okay. Do you feel y'all have the adequate resources to pay rent and pay your utilities just fine? Okay. Do you associate with a religion?
Yes.
What religion?
We work at First Baptist Church around Rock.
So you're Baptist?
Yes.
Okay. Do you feel you have the social or spiritual support that you need?
Yeah.
Okay. How about smoking?
No.
Any chewing tobacco, pipe tobacco,
No.
electronic cigarettes or marijuana?
No. Too
Any-
much.
Any illicit drug use?
No.
Okay. What about drinking alcohol?
I may do it socially, maybe once, twice, maybe a week.
Okay. So just 1 to 2 drinks a week. Okay. How about your diet? Do you follow a specific diet or do you just eat?
No.
Okay.
Pretty much eat what's here, with the house or so.
And what about an exercise plan?
Work out enough at the warehouse.
Okay.
So that's pretty much giving my exercise for the day.
Alright. Do you have any hobbies that you enjoy doing?
We go fishing with my son.
You go fishing with your son?
Or we'll watch some sports or whatever, so.
Oh, okay. Okay. So the next questions that I'm going to ask, I just need yes or no answers.
Okay.
It's going to go over a review of just basic body systems and see if you have any of these systems, okay?
Okay.
Symptoms, I apologize. So fever, chills, any weight changes up or down in your weight?
No.
Recently, how about night sweats?
No.
Okay. I see you're in glasses. Do you have any blurred vision, double vision, any eye pain, glaucoma, or injuries to the eye?
No.
Okay. How about any changes in your hearing, hearing loss, ear drainage, or ear pain?
No.
What about ringing in the ears or dizziness? Okay. So any nasal congestion, bloody nose, nasal drainage, or change in your sense of smell?
No.
What about dental issues, which includes any hardware in the mouth or fillings?
Probably maybe 2 fillings in my mouth.
Okay. When was your last dental visit?
Probably about a year ago.
Okay. Any history of dry mouth, ulcers in your mouth, taste disturbances, or changes in your voice?
No.
Okay. What about pain or stiffness in your neck?
No.
Do you feel like you have full range of motion in your neck?
Mm.
Do you have any lumps or tenderness around your neck?
No.
Okay. How about any node enlargement? So the nodes, the lymph nodes that are in your neck, or right here under your arms, or in your groin?
No.
Okay. Any asthma, shortness of breath, coughing, wheezing, sleep apnea?
No.
Okay. How about any chest pain, heart attack, palpitations, racing heart, or dizziness?
No.
Okay. Any heartburn, nausea or vomiting, diarrhea, constipation, bloody stools, abdominal cramping, ulcers, hemorrhoids, increase or decrease in appetite, or
No.
trouble swallowing?
No.
Okay. Any painful or bloody urination?
No.
Any penile discharge?
No.
Or a history of sexually transmitted diseases?
Nothing know of.
Okay. Ever had a problem with kidney stones?
No.
Okay. Able to obtain and maintain an erection?
Yes.
Okay. Any decrease in your sex drive?
No.
And did you have puberty at a normal age?
Yes.
Do you remember how old you were?
Probably 12 or 13.
Okay. All right. Any infertility issues besides the miscarriages that we've talked about?
No.
Okay. Any pain in your calves or while we're walking?
No.
Any joint stiffness or pain?
No.
And do you feel like you have full range of motion in your joints?
No.
Okay. How about bruising or blood clots, history of blood transfusion, heat or cold intolerance, or a bleeding disorder?
No.
Any enlarged thyroid? Any weight changes or excessive thirst or urination? Okay. Rashes?
No.
Dryness of your skin? Any changes to your hair or nails?
No.
Frequent headaches? Dizziness? Fainting?
No.
Sleep disturbances? Any tremors or unsteady walking? Any depression? Thoughts of hurting yourself or hurting others?
No.
Anxiety or worry that's taking over your daily life? Okay. Alrighty. Well, thank you for answering my questions. We'll be continuing with your physical assessment shortly, okay?
Sure.
Thank you.